And the first thing that I would tell anybody that is on social media, that has a platform or that is growing a platform, is that you actually don't have an obligation to speak on anything that you don't want to speak about. And it's okay to stay silent. And there's probably times where you should not post anything. But just because there is a world event happening does not mean you have to chime in on it with whatever the current political winds are blowing. So when it comes to advocacy, there may be times where you do want to speak out on issues, but I think that you should approach this cautiously. It should go with a lot of thought. You should be well informed on the particular issues before you dip your toes in the water, because there's nothing worse than stepping on the wrong side of an issue or in entering a conversation with incomplete information.
Welcome back to Med Creator 101. I'm Mimi Banks, the founder of MB Social, and I'm here as always with the inspiring Medfluencer, board-certified dermatologist, Dr. Dustin Portella.
Hi, Mimi. Good to see you.
Good to see you too. I'm excited for this episode because it's something that's very personal to both of us.
Indeed, yeah. Today we're going to be talking about advocacy and as a social media personality, when you should consider using your platform for advocacy.
So, advocacy. And let's talk about how you use your platform to really bring your values to life in a meaningful way. As a practicing medical professional and Medfluencer, how do you decide, or how have you decided which issues that you want to advocate for?
This is an important topic, and I know that people have different views on using your platform. And it seems like over the last 5-6 years, every week we have a new world crisis or something that you could speak out about. And people get all up in arms about it. And I have seen people get on their platform and say, if you have a platform, you are obligated to speak out on this issue. And the first thing that I would tell anybody that is on social media, that has a platform or that is growing a platform, is that you actually don't have an obligation to speak on anything that you don't want to speak about. And it's okay to stay silent. And there's probably times where you should not post anything. But just because there is a world event happening does not mean you have to chime in on it with whatever the current political winds are blowing. So when it comes to advocacy, there may be times where you do want to speak out on issues, but I think that you should approach this cautiously. It should go with a lot of thought. You should be well informed on the particular issues before you dip your toes in the water, because there's nothing worse than stepping on the wrong side of an issue or in entering a conversation with incomplete information.
I could not agree more. I think that there's a lot of people who are self-professed TikTok educated professors and think that they are the expert on a given topic. And quite frankly, it comes off as truth, and that it's part of the misinformation. I'm very quick to unfollow people that have no business sharing something, either are not connected, have no prior knowledge, or just think it's their duty to act as an ambassador for something that, while they might believe in it personally, that has nothing to do, at least seemingly, with their content or brand that I was drawn to. And I think that you make a very good point about really thinking through the issues that you want to publicly put a stake in the ground for.
I would say for the first 2-3 years of my journey on social media, I didn't step into anything related to social or political issues because I was focused on growing my platform. I wanted to remain a neutral space, and I wanted to approach my audience in the same way that I might approach a patient that's sitting across from me in my clinic. And I want people to be able to trust me. And in most cases, my personal views are not going to come into play. And if I were to be open about any particular personal view, it could only alienate 50% of people. So I didn't find it important to dip my toes in the water on most issues that were happening. And the time that I did start to do that, it was very relevant to the type of content that I was putting out as a physician.
I was going to ask you about that. So if we even go back to COVID, your platform really remains dedicated to your mission as a dermatologist. Let's go through times that you have spoken up and how you decided to speak up.
Yeah, ultimately, on my social media, I'm concerned with helping people to become or to stay healthy. And for, many people, that's going to be healthy lifestyle habits. That's going to be good sleep, good diet. It's going to revolve around access to care and issues surrounding that might include insurance companies, pharmacy benefit managers, or legislation, political topics that are revolving around healthcare in the United States by and large. And so most of the time when I have done any so-called advocacy work on my platform, it has largely been around issues with health insurance and access to health services in the United States, because that's the area that I'm familiar with. I'm not very qualified to speak on the health system of the NHS in the UK or of the Canadian system or of any other country, because I'm just not intimately familiar with it.
But there is another cause that actually is close to your heart that you are really passionate about, which is providing care to in underserved areas or those who don't have access to it. And so it's not always about making a public statement or a stance. Advocacy can be taking something that's very close to your heart and really championing it. Can you share more about your incredible mobile dermatology project and the value you provide to these underserved communities?
This is a project that I have wanted to do since I was in medical school, when our medical school had a club called the Homeless Community Outreach. And what we would do is on Sundays, we'd go out and we would take fresh water, coffee, dog food, clean socks, new batteries, all sorts of things that just somebody who is unhoused might need in their current situation. And then about once a quarter, we had a motorhome in the medical school. We'd go out and do physical exams. We'd refill prescription medications and provide general primary care to these individuals in the Des Moines, Iowa area. And this was the first time that I was able to do a physical exam and report to an attending physician on what I was hearing when I listened through my stethoscope and any concerns that the patient brought up, and then prescribe medication for them and have that brought from the pharmacy to these individuals just to, help with compliance and actually using the medication that they were being prescribed. And I kind of resolved at that time that I would do this at some point, not even knowing what specialty I was going to go into. I had been thinking about emergency medicine, anesthesia, radiology, and dermatology was in the back of my mind, and ultimately settled on that. When I got into practice and opened my own clinic, after a year or two, I started looking into the feasibility of doing this. I was talking to a couple of companies that could customize motorhomes that would do this for groups where you see mobile dental with Delta Dental, for example, or mobile mammography, as many hospitals offer, and found it was a pretty expensive project. And as I started to grow on social media and generated additional income, I got to the point where I could afford to sponsor that project myself. And then was fortunate enough to find a community sponsor with a local credit union who also wanted to participate in that. And they made a donation as well. So in doing that, we've been able to open the mobile clinic and go to clinics in the area that don't accept any insurance. So they're only for people without insurance, and be able to provide specialty dermatology care, which is not something they usually get at these locations. Most of the dermatologists are staying in their clinics and they're as busy as possible. But going to these places, we're able to take some of the burden off the primary care providers who are not as familiar with skin conditions, especially complicated ones, and then do free skin cancer screenings. Even if somebody does have insurance, we're doing those throughout the state. And Idaho has a large percentage of melanoma compared to other states with worse outcomes. And so providing these in my home state has been really rewarding. And it champions this cause of providing care to people who need it most. But it's not necessarily me stepping into the waters and saying we need a single payer healthcare system or we need to get insurance reform or anything. It's just about doing good for the people who need it the most.
It's doing very good. How many skin cancers have you detected?
So we did 3 clinics where we performed biopsies, and we did 3 skin cancer screening events where no biopsies were performed, but referrals were made. And in doing this, we found probably 40 to 50 potential skin cancers or actual skin cancers through these 6 events.
Wow.
And so that was something that was definitely needed when patients needed surgery. Even if they couldn't pay, we were bringing them into the clinic and I was doing surgery on them for free. So we're not abandoning these people if we diagnose a skin cancer. We're following through and continuing to pay for that out of my own pocket.
That's really incredible. And you're right. It's advocacy is doing something for good. It doesn't just have to mean like speaking out against something. It could be giving back in different ways. And what are the future plans for the mobile clinic?
So the mobile clinic will continue to serve as a community resource. We're going to continue to do free skin cancer screenings in partnership with the credit union that we're working with. And we're going to continue to do some work with the free clinics in the area, but we'd like to get out to other communities in the state that have free clinics. And then we also have plans to take, I don't know a better word for it, but like an audition, so to speak, where somebody could submit a video and discuss their skin condition and ask for us to come help. And then we would just go to them and provide one-on-one care. But we would use that as an educational resource to film the encounter with patient permission and help to educate on potentially a rare condition that through social media, other people could benefit from, they could learn from, they could see what the treatment options are. And it may not be a rare condition. It may be as common as psoriasis, but then just putting out all the information about the novel treatment types that are now available, I think would be a big help to somebody. So that will start up here in 2025, where we take specific inquiries from people in addition to the kind of work that we've already done.
I mean, that's great. Being able to even know what to look for and know what the warning signs are, know what even to think about the skin condition that they're seeing is already a huge help.
This is a project that I love doing, and I've altered my clinic schedule so I could have more time to do it.
Wow. So thank you, Dustin, for sharing that incredible feedback on your point of view towards advocacy. We want to hear from you. We want to hear the projects that you're working on. We want to hear what is important to you. Drop us a comment.
We want to thank you for tuning in to this episode of MedCreator 101, where we discussed advocacy. Advocacy is not something you need to get into immediately upon joining social media, but it is something that you can think about. Advocacy doesn't just mean speaking out against things, but it can also mean promoting certain things. Be careful as you step into advocacy that you don't get into every single issue, especially if you are not well informed on that issue. Also be prepared for potential backlash if you're getting into advocacy, because not everybody's going to agree with you. It's important to use your platform in a way that serves you and the audience that you are trying to reach, and you should do that with passion, but with great consideration as well. If you guys have questions or comments, drop us a message on Instagram. Thanks for joining us, and we'll catch you next time.